restless to make it up through. It's only love and that is all. Why should I feel?
Hi all my wonderful TM joiners. I'm Priya Mistry, the TMJ doc, and this video is about how to manage TMJ pain and dysfunction from the comfort of your own home. The information in this video is not a cure. It's simply a way to help manage pain, at least temporarily, until you can get to somebody that can help you more. This is a two-part series, with this part being part 1. So be sure to watch this and then stay tuned for part 2, which will be out in the next few weeks at some point. Feel free to leave a comment below. Your comment may be featured in my new segment called Highlighting a TM Joiner, where I take and highlight one of your comments and I respond to it. So feel free to do that. Before getting into it, be sure to check out my other social media accounts. I'm quite active on Instagram and TikTok, kind of a little bit on Threads. And so there's a lot of information when you combine all of those accounts. Some are short form videos, some are long form videos. Either which way, there's a lot of information. So be sure to check those out. For those of you who don't know me, I'm a general dentist with a practice in beautiful Vancouver, Washington. At my practice, we are limited to and dedicated to taking care of those with TMJ disorders, TMJ pain, and dysfunction. So let's get right into it. I think the easiest way to break up all of this information is to break it up into lists of do's and don'ts. My TMJ mentor, Dr. Arthur Parker, always told me that treating TMJ was more about not doing than it is about doing. So what does that mean? That means that TMJ treatment is more about resting the jaw, giving it a break, rather than overworking it and over-exercising it and trying to strengthen it. Many people reach out to me asking me what sorts of exercises they should do or how to strengthen the jaw to make it work better or to make it feel better. And I always respond with, please don't exercise it, because jaw exercises, especially aggressive ones, can definitely make the pain and dysfunction worse. So please stay away from stuff like this. This exercise ball that I have displayed here, please do not use this. So again, I've broken up all the information into a list of do's and don'ts. So let's list all the do's and don'ts off, and then I will circle back around. And in this video, I'll be going over all the do's. Part 2, I'll be going over all the don'ts. Let's go over those do's. Number 1, do use face rollers or your hands to massage the muscles of the head, neck, and jaw. Number 2, do gentle neck stretches daily. Number 3, use a calcium magnesium supplement. Number 4, hydrate. Number 5, meditate. And number 6, try to sleep on your side rather than your back or your stomach. Now let's go over those don'ts. Number 1, don't chew gum or ice. Number 2, don't bite your nails or use your teeth to rip open things. Number 3, don't drink too much caffeine. Number 4, don't rest your hand or your fist against your jaw when you're working at a computer. Number 5, don't rest your hand against your face when you're side sleeping. Number 6, don't sleep on your back or your stomach. Number 7, don't chew tough or super difficult to chew sorts of things that are glutinous in nature if you're having a TMJ flare. Number 8, don't sweat the small stuff. Let's start with that first do. Do use facial rollers or your hands to massage the muscles of your head, neck, and jaw. I'm going to be demonstrating with these lovely facial rollers that I sell on my website. So I've got that linked above and below. These are cool to the touch, which I like. That feels good to me. But some people prefer heat. So you can always wrap these in like a warm towel before you use them. You can warm them up a little bit, and that can feel quite therapeutic as well. Before we actually massage the masseter muscle, let's visualize it first. The masseter is a large muscle that starts right underneath the cheekbone. And it goes all the way down to the border of the jaw. This is a main muscle in clenching and grinding activity, and it is prone to building up trigger points or tight bands of fascia and tissue that can be quite painful. To massage the masseter, you're going to take both rollers. There's a small end and there's a larger end. I would say probably for adults, the larger end is almost always appropriate for everybody. Again, this is a big muscle. So you take the rollers and you put it right underneath your cheekbone. Then I'm going to ask you to bite down gently in the back. Just a little pressure, don't clench super hard. And then with pressure inwards towards the center of your head. Hold that pressure and roll down slowly. I've included a picture of the masseter here, and what I think is helpful is to actually visualize the muscle while you're massaging it. I just find that to be helpful in terms of being at the right spot mostly. Now, depending on the width of your face or how much you've worked out those masseters from that clenching and grinding activity, your masseters may be wider than somebody else's. So just make sure you really get the entirety of that muscle. So you can go forward, you can go backwards a few times just to make sure that you've really covered the entire muscle. So you can do this up and down motion 4 or 5 times, 3 to 4 times a day. And that should help bring relief to these muscles, which can be tight and tense, causing jaw pain. Before massaging the temporalis muscle, let's go ahead and visualize it. The temporalis muscle originates on the temporal bone, which is a large skull bone here. And it inserts into the coronoid process, which is a little bony projection on the jawbone. This bony projection is about an inch, inch and a half in front of the jaw joint itself. So it'd be like right about here on me. The temporalis is a large fan-shaped muscle. It is very involved in clenching activity, and since many of us clench, that can be a main area that holds a lot of tension. And when that muscle gets really tight and angry, that can actually lead to tension headaches, which most, if not all of you guys watching have experienced, unfortunately, as I have. To massage the temporalis, you're going to start about an inch or so in front of your jaw joint. So if you open and close right in front of your ear, you're going to feel something start to stick out as you open and close. That's the jaw joint. So go an inch, inch and a half in front of that, and that's where you're going to start this massage. Now for this massage, you're also going to press inwards, just like with the masseter massage, but with way less pressure. And that's because the temporalis muscle is very, very, very thin and just right up against the skull, whereas the masseter muscle is quite meaty and it can just handle a lot more pressure. So let's take our rollers and we're going to start about an inch, inch and a half in front of the jaw joint. And then with pressure inwards, gentle pressure, you're just going to rub up and back. And again, visualize this muscle as you do this. This is a large muscle. So you may want to run it a few times, a few different directions so you get the entirety of the muscle. This one feels quite good as well. And you're going to want to do both at the same time. I'm just doing one for demonstration purposes. This is another one you can do with 4 or 5 rolls, 2 or 3 times a day. And that should help sort of ease up the tension that's held in that muscle. Again, these rollers are linked above and below. Now I'll show you how to massage these same muscles, but with your hands. So you don't need any fancy tools necessarily. So for the masseter, that big one here, you're going to take your middle knuckles, which are these guys right here, on both hands. You're going to bite down gently in the back, just like before, and you're going to place these right underneath your cheekbone on both sides, and with pressure inwards, rub all the way down. This one always feels lovely. No matter what day or time of day, this one just feels good. This is one that you can do 3 or 4 times, 3 or 4 times a day. The next way to massage the masseter with your hands is actually a method that requires you to go inside your mouth. So what you're going to do is grab your thumb and your pointer finger, and you're going to go inside your mouth with your thumb all the way back until your thumb hits bone. So you're going to run along the length of your cheek until your thumb hits bone back there. So for my left side, I'm using my right hand, and then vice versa for the next side. So I'm going to go ahead and show you guys. I'm hitting bone. Once I'm all the way back there, that's when I'm going to reach around with my pointer finger and grab the actual masseter muscle. Then I'm going to pinch the muscle between the fingers. And again, be careful how much pressure you use here. Some people can handle more than others. So just gauge it and be careful. It should feel like it hurts so good almost, but not just that it hurts and is sending you through the roof. So you're going to pinch and then you're going to drag your fingers forward. And you're going to repeat that along the whole length of the muscle. So every time you come forward, go back and start a little lower. Go back and start a little lower. So I'll demonstrate that for you. Another pro tip there is that when you get your thumb all the way back there, close your mouth halfway. When you close halfway, that just makes accessing everything easier back there. That one feels quite good too. And the reason I like that one is because it runs perpendicular to the fibers of the masseter muscle. So we ran parallel with our knuckles, and now we're running perpendicular with our fingertips to really get into that muscle and release the tension that's in there. To release the temporalis muscle with your fingers, you're going to actually take your fingertips now. You're going to start about an inch in front of your jawbone, press inwards gently. Again, be much more gentle with the temporalis than the masseter. And run your hands up and back. And up and back. This one feels really good too. You can even sort of just stay in one spot and really, really work in there and just rub back and forth. Forward and back with pressure inwards. And again, you'll be doing this on both sides at the same time, but for demo purposes, I showed it to you this way. As a disclaimer, please do these massages and stretches gently and at your own pace. Let's move on and release the lateral pterygoid muscle. This muscle is small. It is about the size of the end of my finger, but when it is in a dysfunctional state, it can wreak havoc. It can cause headaches, pain behind the eye, pain into the ear, jaw pain, tooth pain. So many things can come along with this tiny little muscle being super tight and super constricted. The lateral pterygoid muscle starts on the pterygoid plate of the sphenoid bone, and it inserts into the disc of cartilage inside the jaw joint, as well as the jawbone, the top bony knob of the jawbone. Many people think that you cannot reach this muscle, and I beg to differ. I think that you can reach the inferior head, the bottom part of this muscle, and the fascia that surrounds it. And by doing so, you can influence that muscle and you can treat it. There are a few ways that you can release this muscle on yourselves. And one thing to keep in mind is that not everybody can reach it on themselves. It depends on your finger length as well as your jaw anatomy. Another thing you want to keep in mind is that you want to have short nails when releasing this muscle. You cannot, you should not, cannot do this with long nails. So please don't. To try this, you can start with your right pinky to release your left lateral pterygoid. You're going to take your pinky and you're actually going to turn it so that the nail is facing the teeth and the pad of the finger is facing the cheek side. You're going to take your finger and go inside your mouth as far up and as far back as you can go. Once you get there, close your mouth halfway and you'll find that you can probably even go a little bit further. Once you start to feel some discomfort, you're probably in the right spot. Once there, you're going to hold for about 10 seconds and then come out a little, and then come out a little, change the angle of your pinky and go back in. Every time you hold, you're going to hold for about 10 to 15 seconds and not longer. Now, this release is no walk in the park, my friends. The masseter and the temporalis releases that we just did feel wonderful almost immediately. This one can actually hurt quite a bit when you're doing it. It does bring relief later, though, for probably like 95% of people. But there are the 5%, there are the rare few that this actually triggers more pain later. So please be careful. I'm not trying to cause anybody pain. I'm trying to help. So I'll go ahead and demonstrate this release. You're going to take your pinky, like I said, go all the way far up and back. And then once I'm back there, I'm applying pressure. Not the most graceful thing to demonstrate. So I was actually able to get back there and release that muscle. Now let's try another way. For this way, you're going to actually take your pointer finger, so right pointer finger and right lateral pterygoid. So we're going to keep everything on the same side this time. You're going to take that finger and point it sort of up and then towards the teeth, so at a bit of an angle. Then you're going to go all the way as far back and as far up as you can between the teeth and the cheek. And you're going to close halfway and then just sort of hold with pressure in that same angle. So I'm going to demonstrate. You probably saw me come out and go back in a few times, and I actually ended up turning my finger a little more towards the teeth as well. So I was able to reach the muscle again and release it. And again, this one for me always feels really good. This one in particular has brought me a lot of relief when my jaw is hurting or if I have like a temple headache. That doesn't happen often for me. It's maybe like once or twice a year. But when it does, it's really nice to have this little tool in my tool belt where I can bring the pain level down instantaneously. And with that one, be sure to gauge how much pressure you can handle and proceed with caution. We don't want to overdo it when releasing the lateral pterygoid. Now let's move on to the neck. The neck and the jaw are intimately related. So it makes sense that they sort of feed off each other. Loosening up and stretching and massaging the neck can be quite beneficial for headaches and jaw pain and even jaw range of motion. Let's start with a few simple massage techniques for the neck. The first massage I have is for the trapezius, and it's pretty simple. You're going to take your 4 fingers here, and you're going to reach behind and place them directly above your shoulder blades. Once you're there, tilt your head forward and slowly, with pressure downwards with these fingers, so press on your tissue, you're going to drag those fingers slowly forward with pressure. This should take anywhere between 5 to 7 seconds for each drag forward, and you can do this about 5 times. Be sure to peek up and take a look at the image here. I'm showing you exactly where your finger placement should be because obviously you can't see where my fingers are here. This one feels really good. I can definitely feel that there's a knot on my left trapezius as I come down and forward, and hopefully this is loosening it up some. You can do this 5 times forward, maybe 2 or 3 times a day, and this should help to loosen up that trapezius muscle. Many of us carry tension in our neck and shoulders, and this can help relieve that. Let's move on to the next massage technique. For this one, you're going to take those same 4 fingers, but this time you're going to stack them on top of each other and place them directly behind the base of your head, on the back of your neck. So there's a bone at the bottom back here, and I've demonstrated it in this illustration. You're going to place your fingers on top of each other directly underneath that bone, the occipital bone. So again, for this one, you're going to tilt your head a little bit forward, and with your fingers, you're going to apply pressure forward and towards the center of your body. And then you're going to slowly drag your fingers all the way down from the base of your skull down to the 6th cervical vertebra. Your 6th cervical vertebra is the little bony hump shown, and I've put it in this image. So you should all be able to find this bone as sort of like a landmark for this massage. This one you can do 5 times, just like the first one, 2 or 3 times a day. So these are the 2 self-massages that for me really help to loosen up my neck. Now let's move on to some gentle neck stretching. Let's stretch that trapezius muscle. So first you're going to take one of your hands. Let's take this one. And then you're actually going to sit on it. So I know you can't see me, but you're just going to sit on your hand. Pretty simple, pretty basic. Then you're going to take your opposite hand and wrap it around your head, kind of close to your ear. Then with gentle pressure, you're going to pull or push, however you want to think about it, your head the opposite way or towards the arm that's lifted. Very gentle. And this will stretch that trapezius out. You can do this for about 15 to 20 seconds, 3 or 4 times a day. This muscle doesn't typically get this type of stretching, so it feels very good. And you're going to want to do the same thing on the opposite side. Now let's move on to the last neck stretch. For this one, you're going to actually interlace your fingers and you're going to place them behind your head on the occipital bone. It's the bone at the bottom of your head back here. Again, you're going to tilt your head forward and then gently push it even further down with your hands. Now the key word here is gentle. Do not push hard, my friends, okay? This can be a sensitive area. You want to be very, very gentle here. Even being gentle, you can get a very good stretch. This one you can do 20 to 30 seconds, 2 or 3 times a day. So I did all of these releases, these stretches, these massages for maybe like 15 or 20 seconds, and I already feel loosened up. So if you actually do them a few times throughout the day, you should be feeling better by the end of the day. If you've been kind of following along and doing them as well, and if you feel some relief, I would love to hear from you, so please comment below. Let's move on to a calcium magnesium supplement. Most of us are actually deficient in magnesium. And what magnesium does to help the muscles that are dysfunctional and angry if you have TMD is that it binds to a certain protein and it makes it so that the muscle relaxes. So magnesium does wonders for the angry muscles of TMD, but it should be taken with calcium as well because calcium and magnesium work together in a number of bodily functions. They are synergistic. I've linked my favorite calcium magnesium supplement. It's called Osteo Formula, and it's by Mountain Peak Nutritionals, which is a local company that my mentor used for 20 plus years. It has bioavailable forms of everything in it. We've had great success using this with many patients as well. So I like this one. So be sure to check it out. Many of you also may have supplements at home, so just make sure you know what you're doing dosage wise. I have a whole other video on calcium magnesium, so I've linked that as well. Now let's talk about hydration. The dysfunctional muscles that are involved in creating the pain that comes along with TMD are also often dehydrated muscles. And dehydrated muscles will definitely spasm more and cause more pain. Most of us do not drink enough water. So please do so. That's a great way to start. You can do your own research about hydration, electrolytes, etc. But I have found that many of us just don't even like or drink water, which is crazy to me. I love water. I do have these water bottles that have my logo and my name, but they also have little time marks. I don't know how well you guys can see this. That'll sort of help you get through the day, tell you how much water you should have already had by a certain time of the day. And this can be helpful. Keep this with you at all times if you do end up getting it, and it can help to get you to a good, healthy, hydrated level. Now let's talk about meditation. This one is a hard one for me, to just sit and be alone with nothing in your head. That one's really hard. My mind is always racing. I'm thinking about my children. I'm thinking about my husband. I'm thinking about my practice. I'm thinking about my patients, like one thing after another. So to sit down and meditate and just really be at one with yourself and push your thoughts off, that can be a hard thing. I've done it successfully a few times, and my goal is to sort of carve out more time to do this in the coming year. Having said that, the few times that I've done it successfully, it's really provided a lot of relaxation and just this feeling of calm. And I haven't been able to accomplish that by doing anything else. So I feel like this can be very helpful for us sort of type A, stressed out individuals in this world. There are some apps out there. There's Calm and there's Headspace. I am not affiliated with either of those in any way, shape, or form, but I've heard that they're great apps. I did use Calm for a while for meditation, so I know that that one's good. And so check those out. That might be helpful if this is something you're trying to get into. And lastly, let's talk about sleep position. Now, the recommendation and advice that I have on sleep position is not going to work for everyone. This is general advice that works for most people. I recommend that people that suffer from severe TMD or even moderate TMD, lots of pain and dysfunction, I recommend that those people sleep on their sides. And this is why. Sleeping on your back can make it so that your airway is much smaller, which can lead you to struggle for oxygen. If you're struggling for oxygen, you go into fight or flight and you tend to clench and grind with more force, frequency, and for longer durations. So sleeping on your back can make sleep apnea worse if you have it, which can then make TMD issues worse. Sleeping on your stomach forces you to kind of turn your neck so that you can breathe. And that is not great for the neck. It does not like that night after night after night. So if you irritate the neck, that can feed up and irritate the jaw. Sleeping on your side really eliminates all of that. But the only thing I have for that is you have to have a pillow with good neck support. You have to, or you're just not going to be comfortable on your side. Additionally, I always say, please don't sleep with your hand against your jaw. It can be under your pillow so that there's some space there, but we don't want lateral pressure, something hard against your jaw. For more information on sleep position and TMD, please watch my video on it. I've linked it above and below. I hope you found all this information helpful. Now let's move on to my new segment, highlighting a TM joiner. The comment I've chosen to highlight is, do you recommend any of your patients to get braces or Invisalign after the orthotic? Is it ever required to fix tooth positioning after correcting the jaw positioning? Great question. And yes, sometimes I do recommend that my patients get braces after TMJ treatment. Some people come to me with their bite really off to start with and a lot of TMJ issues. Once we take care of those TMJ issues, then some of those patients are interested in correcting their bite, and I kind of point them in the right direction. Or some people have to because their teeth just don't come together at all. Other times, the bite can actually change a little bit through treatment. Now, some of these changes are not dramatic enough to need braces or Invisalign, and some of them are. And so some of my patients I refer for braces or Invisalign afterwards, and the vast majority of them I do not. With my treatment, I really try to minimize the chance of the bite changing throughout TMJ treatment, but oftentimes TMJ issues are there because there's a bad bite. And so fixing the TMJ can have an effect on the bite. They are often related. So I hope this answers your question. If you have more questions, check out my video, Phase 1 versus Phase 2 TMJD treatment. So that's really it, my friends. I hope you found the information in this video helpful. If so, please feel free to like, subscribe, and share with your family and friends. Please do keep in mind that questions and comments are always welcome. I try to get back to everyone. It just is taking me some more time these days, so please be patient. And remember, my friends, you can never have TMI about TMD. Thank you.
Very bright, just the